I'm Mike Gloor. I'm a Nebraska state legislator from Grand Island. Prior to going to the legislature, I was the chief executive officer of the hospital in the background for 16 years, and with that experience, as you can imagine, I have some pretty specific opinions about healthcare reform as it's being debated. My main argument is we need to make a decision as a society whether healthcare is a service like law enforcement, firefighting, or whether healthcare ought to be subject to a competitive model, free market system with some sort of safety net to provide care to those who can't afford to provide care for themselves. One or the other option will be a huge improvement over the schizophrenia we have right now in the system, where we have both the free market system as well as the service model. I think most people look at healthcare as a service, but by the same token, it is a market system that gets purported to be at work in a lot of communities, and that pull and tug between both of those is problematic, and I think lowers the overall quality and increases the cost. A commitment to one over the other, and I can make an argument either way, is an improvement over having both at work within our system. We also have a problem with fractionalization in healthcare. And by fractionalization, I mean there are, I believe, over 7,000 hospitals in the country. Very few of them are connected to each other. And that fractionalization makes it difficult to exchange information, exchange medical records freely. That also can have impacts on quality. That fractionalization means it's hard to put together the savings you could realize from group purchasing contracts. And think of it from the standpoint of getting estimates. If you want to shop for healthcare services, if you're in a car accident, you can get an estimate on your car from 2 or 3 different repair shops within a couple of hours. But if you break your leg, getting an estimate to get your leg fixed, assuming you want to take the time, you have to get estimates from ambulance services, emergency rooms, the hospital where the surgery to repair it's going to be done, orthopedic groups, anesthesia providers who might be private practitioners, physical therapy groups afterwards, different pharmacies. All of that are separate, distinct components of the system, and that fractionalization makes it harder for you as a consumer to shop for health care. There's one of the arguments against a market-driven system, because it's so hard for the consumer to actually shop for health care services.